We're live. Okay. Good evening. Welcome to the Committee of the Whole agenda meeting for the City of Beaumont City Council on Tuesday, March 19th, 2024 here at 5 p.m. in City Council chambers. Deputy Mayor McCook is not able to attend in person, so I'll handle the meeting for her. I believe Deputy Mayor McCook and Councilman Gosselin are both joining us by Zoom. Are they online? Not yet, but shortly they'll be joining us as quick as they possibly can. So we'll have 5 of us in person and 2 online. And I'll call me to order now here at 5:01, begin with our land acknowledgement, as we always do. The City of Beaumont respects the histories, languages, and cultures of all First Peoples of this land, whether it be a First Nation, Métis, or Inuit descent, and appreciates that their presence continues to enrich farming communities across the land. As we gather here in Treaty 6 territory in the homeland of the Métis Nation, we acknowledge that we are all treaty people and have ongoing responsibilities to protect and honor the treaty, the inherent rights of the people, and the land. Thank you. Next on our agenda is adoption of the agenda. Madam Clerk, would you put the agenda on the screen, please? Any changes to the agenda, Madam Clerk? None? Thank you. Member of Council willing to move the agenda as presented? Councillor Barnhart.
Yes, Mayor, I'll move that the March 19th, 2024 Committee of the Whole meeting agenda be adopted as presented.
Thank you, Councillor. Discussion on the motion. Any members of Council? Seeing none, Council, I'll ask you to vote on the agenda as presented. And I'm assuming until I hear otherwise, we'll just have the 5 of us attending until other 2 councils can join us. Okay. Councilor Swain, did you hear the motion to adopt the agenda as presented? Okay. Yeah. Well, I've got the 5 votes for the agenda, so I'll accept that. Motion has passed on the agenda, and we'll continue on with our meeting. And Sam will join us as soon as his volume is ready to go. The adoption of the minutes of the Committee of the Whole of February 20th, 2024. Member of Council willing to move the adoption of the minutes? Councillor Penrod.
Thank you, Mayor. I move that the February 20th, 2024 Committee of the Whole meeting minutes be adopted as presented.
Thank you, Councillor. Discussion on the motion. Many members of Council? Seeing none, Council, would you please vote on the motion to adopt the minutes? Councilor Swain, are you happen to join us by any chance on audio?
I'm here and I'm in favor.
Thank you, Councillor. That carries 6 in favor, none opposed. Councilor Cook will join us as soon as she possibly can. We'll continue on. Item 4 is open forum. Madam Clerk, nothing in open forum this evening is my understanding. Thank you, Madam Clerk. On to our first presentation this evening is 5.1 Community Health Needs Assessment. Cassandra, Ms. Squires, I believe you'll introduce our guest speakers and I'll have them join us at the front table when they're ready. Your mic is on.
Excellent. Thank you. Good evening, Council. I've been looking forward to this presentation since the project began, and I know many in this room have been anxiously awaiting the results and the data that we've talked about for this project for so long. Today, we have brought the final report from the Community Health Needs Assessment. The project stemmed from Council's strategic plan aspiration to have healthcare services that meet the needs of our growing population. There are several recommendations being presented in the report this evening. Now that this work is complete, administration will be working through the recommendations and developing a health services action plan, which is set to be delivered on April 9th. That plan will detail the actions and timelines administration will take to move forward on the gaps in services identified in the report. With that, I will introduce James Richardson, Christina Crooks, and Cassandra Jutras from MNP to begin their presentation.
Didn't hit stop. All right, let me get your microphone on for you there. It's on right now. Great. Please begin when you're ready. We look forward to your presentation. Thank you very much. Oh, now it's on.
Good evening, Mayor and Council, and thank you, Cassandra, for the introduction. Today we do have 3 of us just to come in person to walk through some of the findings. So you probably guessed by the introduction of the names who's who, but just for clarity, my name is James Richardson. I'm a partner here in Edmonton. I had the pleasure of working with my two colleagues here and a few others that were in behind the scenes on this report. So We'll talk through a number of different components. Christina Crooks to my left is the project manager, and I'll get you just to add a bit more into her in a second. And then we have Cassandra, the M&P Cassandra, on our team as well, and she can give a quick introduction. We'll move through the three of us as we go through the presentation, just in different sections, and we can take.
You put the mic a little closer to your face. It's not big enough sound for people for the recording purposes.
Certainly.
Thank you.
We'll move through the presentation. Our intent was to go through it relatively quickly and then leave plenty of time for discussion, question and answer. But recognizing that there may be times where Mayor, Council, you have a pressing question about exactly what we're talking about. So I'll leave it to Mayor to decide if we want to wait until the end or take questions along the way. So
Let's
is
wait
there
to
a
the end if we
preference?
can. We'll see how it goes. Let's try going for the end and see how it goes.
Okay.
Thank you.
So I'm just going to turn to my colleague, Christina, if you introduce yourself, and then Cass, you introduce yourself, and then we'll get rolling.
Hi, everyone. Thanks for having us today. I'm Christina Crooks. I am a senior manager at M&P, and I'm based in the Calgary office. I work primarily in our Indigenous services team, and I lead our Indigenous health practice. We do a lot of community health needs assessments, and this was a really great project to be part of, so thank you.
Hi, it's nice to see you all again. My name is Cassandra Jutras with MNP, a consultant at MNP, also working primarily in Indigenous health consulting services. Very happy to be here with you today. Thank you so much.
So when we get the presentation up, yeah, thank you. Just going to go to the agenda once we get into presentation mode. Perfect. So we won't spend too much time on the project overview. We'll touch on it briefly just to get a grounding. Again, what was the project? How did it go? What was it about? Then we'll talk through the current state. So what does it look like right now in the city of Beaumont? And then from there, we can outline what has surfaced as the key priorities and then recommended next steps. Our intent is not to necessarily touch on each and every single slide of the copy that you have in front of you. More so going through it, excuse me, going through it on a summary basis, but we can go into any and all the details as warranted. Not a problem there. So I'm just going to turn to Christina if you want to start talking us through the overview, the scope and the approach, please.
Sure. Can you go to the next slide, James? Right there. Thank you. All right, so as everyone knows, the City of Beaumont undertook this assessment of its healthcare landscape to identify needs and priorities of its growing population. And so MNP was engaged to conduct a comprehensive community health needs assessment. And it really focused on looking at current health-related and social services assets, communicating and engaging with residents and stakeholders, and then reviewing and assessing current health-related services and assets. We also researched and looked at other municipalities that were comparable to the City of Beaumont through our research as well. And the key objectives that we undertook throughout this project was stakeholder engagement. So this was a really big part of the project, and we did a lot of comprehensive stakeholder engagement. We'll get into some more details on that. Through that, we moved into the current state assessment. So that assisted us in developing the recommendations for next steps and considerations. And then we worked with the team here, and we conducted a health services planning session to review key findings from that current state assessment and from the stakeholder engagement. And that supported us in determining what the key strategic priorities for health and wellness services were, and then developing those recommendations for each of the strategic priorities. So just a quick slide on community health planning, and I won't go into too many details, but you know, a community health needs assessment is really that first step to community health planning. And so as you can see at the top here, that's what we've done. We've completed a current state assessment, a needs analysis, a gap assessment, and then a strategic prioritization. So subsequent steps in community health planning would be feasibility assessment, doing those goals, objectives, and strategy setting, and then strategies and interventions development. And it sounds like Cassandra and her team have a good next step plan, which is that action plan that will be provided on April 9th. And then just a quick note on the right-hand side of the slide here, you can see where it says municipal role in healthcare. So this was something that we really kept kind of in mind as we were going through this current state assessment and needs assessment, just ensuring that everybody's on the same page, that municipal's role in healthcare is primarily concerned with resident access to health services for quality of life in the community. They play a role in developing policies and bylaws to support community health and well-being. They're responsible for zoning and supporting healthcare infrastructure development. They develop special initiatives to support community health planning, like this project, for example. And they collaborate with provincial partners to plan how and where resources should be allocated. And I know you all know this, but this was something that we really considered as we moved through the project as well. And so again, I keep saying these words, community health needs assessment. And so we really wanted to keep within that scope and not kind of creep into that community health wants assessment. And so what is a current state assessment? It really provides that full view of the current state of the community's healthcare assets and services. It identifies and assesses the community's healthcare needs and issues on a near, medium, and then longer term basis. And it's a gap analysis and roadmap to a future state. So you're comparing the desired future state needs to what the current situation is, outlining what that gap is between the two, and then laying out that roadmap to achieve that future state. So a community health needs assessment is not a health service delivery plan. It's not a substitute for a specific program to be developed, and it's not a standalone solution for community health improvement. So we are here. We are in phase 3, the recommendations and implementation phase. After completing the What We Heard report, we completed this final report that has been distributed, and we are presenting. And it looks great to see us in that third box. We were in the second one for a while there, so happy to be here in phase 3. All right. So just another note, as many of you are aware, we did collaborate with Alberta Health Services on this unique initiative. The project team worked really close with the Applied Research and Evaluation Services team at Alberta Health Services. And they supported the project process by providing a lot of administrative data for inclusion into the assessment. They participated in that one-day health planning session that we undertook. They also participated in the stakeholder mapping exercise that we did, and provided input and support on the project status updates with MNP and the city team. Some of the data that was included in the current state assessment that really informed a big piece of the report and our secondary data analysis was diagrams on travel data for access to care, inpatient major clinical categories discharge, utilization, clinic continuity, clinical load, virtual visits, urgent care and emergency department visits, and emergency medical services activity. So just wanted to ensure everybody was clear on that methodology and support that was included by AHS. All right, so I believe now, oh, did it go back? Oh, no. Okay.
Yep.
Great, thanks, Christina. So this section of the presentation really speaks to the main findings that we've found as a result of data analysis and engagement with the community and with healthcare providers in a number of different subgroups of the Beaumontonian population. And really a development in priority in the development of this needs assessment was really trying to discern community health wants from needs, because the MNP team knew going into engagement that we would be hearing lots of feedback, thoughts, and opinions on what should be prioritized moving forward. And we really wanted to ensure we were able to separate those out and really understand what needs to be prioritized moving forward. So a community health want in this instance really primarily stems from community input and anecdotal evidence. So although it's important for future decision-making, it's not necessarily reflected in our analysis as an immediate priority. And it also requires further confirmation and triangulation with the data that exists on the current state of healthcare in Beaumont. A community health need, on the other hand, highlights areas where services are lacking. Interventions are necessary, so it's important that the need be prioritized and addressed. And it also still needs to be, or it has been validated by data analysis. So, through a combination of data that we've accumulated through AHS, as well as other sources, we've been able to confirm that these are indeed community health needs. So I'll move on to this slide here. This provides a really great kind of overview generally of what we've been able to find. And you'll notice that we've categorized wants versus needs kind of on a scale here. So I will go through these one by one and kind of give you the overall highlights that came out of the analysis and the engagement. So starting off with access to mental health supports, you'll notice that this one is categorized as a want here. And the reason for this is, we have heard a call from community for increased mental health supports. And when we jumped into the data, we've been able to find that Beaumont, according to the results from the Alberta Health Community Health Survey, is actually faring quite well on mental health indicators as compared to the provincial average. As well, we've been able to dig into the asset map that was created of health services that exist, and the community health assets that relate to mental health services there's a number of them that are available to the community, and so as a result, this was categorized as a want. Access to specialized health services, this is a similar case in which we've heard from the community that there weren't necessarily specialized health services that they wanted that were accessible, say, within Beaumont proper. But when looking at what's available within a 15-kilometer distance to the city center, we've been able to find that there actually are quite a few of these specialized health services that are already available, and there's a number of other elements here on this slide that needed to be prioritized. So as opposed to a need, specialized health services was categorized as a want. In terms of community knowledge of existing key health and social services, we've heard loud and clear from the community and healthcare providers that essentially there's a general lack of understanding of what exists out in the community. What kinds of social supports do Beaumontonians have access to? So that has been identified as a gap. Again, the asset map you'll see in the appendix of the report contains a plethora of different services, and many were unknown to those who attended our community groups. So this was identified as a need to consider moving forward. Primary care practitioners and clinics with capacity for new patients was identified as a need as well. The reason for this is, despite the fact that 90% of Beaumontonians have a primary care doctor, that is more than the provincial average, we have found that through community engagement, the number one thing that came out of the survey was within the next 10 years, Beaumontonians really want to see more access to primary care services. So digging into the data, we've been able to find that, essentially a lot of their primary care providers are well over capacity. Based on our findings, we've been able to see that there's a number of patients that are visiting from outside of Beaumont, just under half stem from outside of Beaumont, and there are most primary care physicians practice on a part-time basis. None offers services on weekends or after hours, and we've been able to find that about let me just flip here so I can make sure I've got my, thank you, that's great. Yes, and we've also been able to find that on average, Beaumontonians visit their primary care physicians about 4 times per year, which you would expect usually a 1-to-1 ratio for that. So again, there is a huge demand for primary care services in Beaumont, but seems to not be enough capacity to be able to respond to that demand adequately. With respect to access to emergent and urgent care, we've been able to look into the top 3 emergency rooms that are accessed by Beaumontonians on a regular basis, and have found that these are meeting the 85% threshold that's been set by the Organization for Economic Cooperation and Development for occupancy to limit the risk of bed shortages. So essentially, most ERs seem to be approaching being at capacity or already over capacity. And so this, again, has been identified as a need, and it was heard that the call for expanded access to emergency care was also heard from community members. Very similar with access to after hours care. There are no after hours care clinics available in Beaumont at the moment. And so we've been able to find that some additional research is required to assess what the capacity looks like for after hours care clinics that are situated outside of Beaumont to actually provide services to Beaumontonians. And of course, recognizing that the population is set to double by 2040, we're expecting that the need the need for access to after hours care, emergent and urgent care, will need to be closely supervised. And this is, pictured as a long-term need here. With referral coordination among healthcare providers, this was also categorized as a need. We've heard from healthcare providers that there are a number of There are a number of roadblocks that come in the way when it comes to being able to provide referrals and use the Leduc Beaumont Devon primary care network. Yes, absolutely.
Our representative, please. Ms. Bujaya?
I'm so sorry to interrupt the presentation. We're having a technical issue. I'm going to ask if we can call for a 5-minute recess. We're having issues with Zoom. And if we lose our Zoom link, we'll lose our external participants, incling the counselors.
Okay.
So if
We'll take a 5-minute break and we'll work on our
Sure.
technical issues.
I'm so
and-
sorry about that.
Unexpected, so take a 5-minute break, everybody, if you don't mind.
Would you like some water?
Yeah, can we get just some water, maybe? We have a moment in our agenda here.
Sure,
so-
yeah, thank you.
Thanks,
Thank
Kathy.
you.
Okay, I'll just wait. Let's see if we're live here. Councilman Swain, Councilor McCook, are you online? Can I hear you? Say yes.
I'm here.
Sam's good. That's good. Okay, you can see the screen. Awesome. We'll get our proposal, our presentation back again. Thank you, Legislative Services, for that great recovery on a slight technical glitch, and thanks for working it through so quickly for us. And with that, we can begin our presentation again. I'll put your microphone back on, and we're good to go now. Thank you for the patience, and we're on again. Thanks.
Great, thank you so much. Yeah, I'm just gonna jump right back into where I left off. So we were just touching on the referral coordination among healthcare providers as a need. So when we were running our survey, we heard from residents that only about 53% reported not knowing how to access services offered by the Leduc Beaumont Devon Primary Care Network. And so out of those who do know how to access it, only 25% indicated that they do use services provided by the Leduc Beaumont Devon Primary Care Network. And what we've heard from healthcare providers is that there's a significant gap there in referral coordination between family doctors and allied health professionals. There's awareness, access, and process issues that all contribute to potential low referral rates. And what we've been able to find through combining that with the data is there's a significant, there's about 65,000 visits to primary care doctors per year, and we're only seeing a certain amount of those being referred out to other services that exist within the Leduc Beaumont Primary Care Network. And so from that being said, we've been able to find that the total referrals being made within the primary care network are relatively low and would need to be prioritized moving forward, just given the consistent issues that have been brought up, especially through healthcare providers that we've heard from with coordinating those referrals. I will, yes, move on to accessible transit services. So this was also prioritized as a need here because we've heard from seniors and people with disabilities that they rely on a consistent transportation system to be able to get to and from the appointments that they need to get to especially in Edmonton. And what we've heard from them is that the park and ride bus system hours are simply not conducive to accessing appointments in Edmonton. And based on a look at the scheduling of bus routes from Beaumont to Millwoods, we've been able to find that there exists an afternoon scheduling gap and an evening scheduling gap that's contributing to the lack of ability to get to appointments. So this was also set to be a need here. And lastly, just around social supports for seniors, people with disabilities and their caregivers, and people within the LGBTQ group, specifically children and youth. We have found that essentially there's an unavailability of social supports and coping skills that we've heard, again, through engagement. And that was among the top 5 non-medical social determinants of health that came out through that survey. We've heard that there is significant gaps in support, at least perceived by seniors, people with disabilities, and young families that are navigating parenting challenges. And of course, with needs essentially doubling as the population doubles by 2040. This is something that we wanted to take a close look at. And based off of our data analysis findings, we've been able to find that there is indeed an absence of services dedicated to supporting 2S LGBTQIA children and youth within Beaumont based on findings from the asset map. And we're also noticing an increased pressure on the FCSS to often offer services that fall beyond their mandate because of an increased pressure being put on them, specifically within rural communities. There's data to support this. So yes, this has also been identified as a need. That is the last need on this slide. And I will pass it on to James to talk you through the associated priorities and recommended next steps.
Thanks, Cass. So the priorities we've put into 3 main categories, and then there's some number of subdivisions therein. So in the first one, with regard to health services, this is very much about an advocacy role. So it's advocating for health services to be brought to the city and then delivered to residents. When you look through, and Cass talked us through the wants and the needs, there's both 3 near, medium, and long-term aspects of that advocacy. Right now, has a lot to do with after-hours care. Also, the medi-clinics, you have full capacity at a lot of the primary care positions. It's not a service that the city can provide, but it's certainly a strong advocacy role, and it ties into economic development. You have the data that supports there's a high need and not a lot of provision. In the second category around regional and intergovernmental collaborations, this is a lot to do with starting from the point of the primary care network. So it's Leduc, Beaumont, Devon primary care network. And when we're looking at the provision of services is within 15, 20 minutes of place of origin. And that starts to get into the region, and you're going to get crossover with some of your other regional counterparts and municipalities in the area. Yes, we understand the growth trajectory for the city of Beaumont, but there's also projected growth in the region. So it is a concern, an issue, and a priority for Beaumont, and it's also an issue and a concern for the surrounding area, I think, which escalates it to a higher priority for other orders of government to pay attention to and look to collaborate. So the pathway to a solution for the future needs and being able to prepare for that includes a lot of regional and intergovernmental collaboration. Lastly, the third category on accessibility. So accessibility has a few different dimensions to it. So it includes the modes of transportation. So in some cases that has to do with transit services, specifically in the seniors group who rely on. There's a higher proportion of that demographic that rely on transit to be able to get to their different destinations. There's also supports to accommodate people with disabilities. There is a lot of remarks actually looking at both current infrastructure, current facilities, that there's some difficulties accessing that. Wasn't the highest and most pressing need, but it was prevalent. So it's important to note, and that's not a tomorrow solution. That's a longer term solution. So it's worth noting from that accessibility perspective. The third piece around accessibility, it's hard to access something if you don't know about it. So there's an awareness aspect to accessibility as well. Cass talked a little bit around there on the needs aspect, and we can look at it a bit more detail here from the roadmap perspective. So pardon me while I just buzz through a bunch of them because I don't want to go through the detail on that one. This one's a bit more interesting to have a look at. I just need to see it on my screen because I can't see that far. So this is divided on the left-hand side. You can see those needs categories. And then you have the timeline where it's not about days, months, weeks, or specific dates. It's put into a bit more general terms because its administration is going to come back with greater detail. What we've looked at is the immediate, which is defined as in the next 0 to 6 months, where those recommendations fall. The short term, which is defined as the next 6 months to 2 years from now. Midterm, 3 to 5 years, and in the long term, 6 to 10 years. And I think what you'll see here on the implementation roadmap is just some of the sequencing that makes a lot of sense. You got to have the building blocks in the right order to get to a tower and get to the progress you're looking to make. So from an access to health services, a big finding that you'll see in the bigger report, certainly in appendix, is the value of that data and the evidence that comes forward that was relatively easy to access and important to interpret. But monitoring and the access, so what's available, how many patient visits are there, what the capacity is in some of the ER, and then the utilization data, that was really important and salient to doing this needs assessment. And it's important to continue to monitor that because those are the key data points that say it's still a need, it was a need, it's still a need, look at the growing need. So all of those trends feed into that advocacy role that the city will want to take when looking for building the infrastructure, attracting some of the services that you need in order to fill some of the gaps. And then in the short term with the knowledge of the data, that's when you get into the enticing other professionals to come because you can point to the need, you look for them to match the services that they can provide with the need. Tends to become a pretty good idea if you have what is required, and then you can set up a practice accordingly. That's kind of the intention behind it. And in the midterm, whether it's a Medi-Center attraction, I know that council had talked about, other initiatives that might be multidisciplinary buildings or facilities. A lot of those are interesting ideas when backed up with the evidence, be able to support it as an economic development opportunity, enticing using the levers that the city has available to it. It can be something that's looked at to both meet a need on healthcare service provision, but also with the economic development benefits that ensue as well. One of the sub recommendations in and around that too is just looking at a trend that's emerging and becoming stronger in the health sector. And I'm sure many of you have heard about it as well. It's the engaging nurse practitioners in the primary care model. And there's two ways in which that can occur. That can be within a primary care network or a team-based environment, which includes physicians, nurse practitioners, and other healthcare professionals. But there's also the ability where, at least from a policy perspective, nurse practitioners are able to set up their own practices, and the scope of services they can provide is pretty close in many cases to what a physician can do on a primary care basis. So it's making sure that's one of the recommendations for council consideration and awareness when the coverage between needs, the gaps, and the future are being looked at. In the longer term, it's not suggesting where it says collaboration with regional and intergovernmental. This isn't a recommendation that says wait for 6 years to do that. It just means that the results of which wouldn't expect until into that longer term basis, especially if we're talking about large infrastructure. Where would a site be for an intergovernmental funded facility, be it a hospital, urgent care, or otherwise? They don't happen overnight. There's lots of competition throughout the province for such things. So I wanted to put that into a longer term perspective. And then lastly, there's going to be ongoing need to work with, much like it's been conducted in this initial assessment, but engaging with those stakeholders to look at what are the needs, what are the strategies, what are the possibilities for services, especially as the population grows. Right now, it's a relatively young population, but growth isn't rarely a single track straight line with all demographics going in the same direction. Looking at what's the needs, what's the gaps, and paying attention to that over the long term is just as important as looking at it now. The access to mental health supports, the really immediate need or the immediate term recommendations has to do with awareness. This was an interesting finding that Cass talked about in the current state analysis. While it came up a lot in the stakeholder engagement, both through surveys and some of the in-person engagement as to a sentiment, there's not enough. When you look at the asset profile, there's quite a bit of service providers. We weren't able to go in within the scope of this one to talk to every single one of them, like how many appointments do you have available, how many are full, but based on the number of providers and looking at provincial averages, it's in line. So there's an assessment that it's probably well aligned. What's missing is there's not enough knowledge of the services that are available or the providers that are there. And that was confirmed through talking to some of the other healthcare providers where they're not aware of the other allied health professionals and the referral places that they can refer their patients to when the needs emerge. So it's build that awareness. There's lots of ways that could be done, but the objective there is to build the awareness. Number two is getting at the point I was just making, getting us some deeper insights. Okay, so we have a number of providers. What about the actual capacity versus utilization and the types of needs that are being met through the services provided? Greater detail would give you a much greater sense of exactly what do we have and what do we need. And then with the emergence of one of the agencies that the government of Alberta's they've created it, but it's still in its nascent stages around the Addictions and Mental Health Agency. That's being built up relatively quickly. It's one that's actually at the forefront of the 4 agencies that are being built right now. But as that comes to fruition and they have the responsibility for that area, making sure that engaging with that agency, looking at what are the current needs here, what are the availability of programs, where's the policy development going, trying to get some of that lockstep happening to meet the needs that exist in Beaumont. Community provider knowledge and awareness of existing key in health and social services. Similar to mental health, there's an awareness piece that needs to come in first of what actually is there and what's available to both referrals and also to residents, what they can access and is already available to them. It's not an easy system to navigate if you're brand new to it. And it's not like there's, handy dandy websites that consolidate everything into one place. So building that awareness will actually help to meet the availability of services with the presentation of need. And that'll be a good start. There's one suggestion that based on the asset mapping that was done as part of this project, you can start to build some layering even on maps, like with a Google My Map is one suggestion, where you can start to plot what are these, where are they, and then what's available to different people. Many different options, but there's a ability, and it's a low-hanging fruit to be able to build that awareness of what is already there to make it easier for people to find, to match self needs with the services that are available to a person. And then from there, it builds into building that communication and connectivity between healthcare providers, so both primary care and then into the referral sources. Not something that is the sole responsibility of the city of Beaumont, but is looking at how is that being done, what could be stimulated for that to occur. I think there's an expectation that that is with the healthcare providers to understand who they are working with and what's available to them. But if there's a disconnect or pieces that can be leveraged to help make that happen, it's a place where the city can participate, but is not responsible for. That's in those detail pages where we actually laid out who all is responsible, what's something that's strictly with the city of Beaumont and what's going to be in collaboration with others, where others have a stake in that process. The longer term aspects of the community provider really just gets into the public education, building more of the network, and then further investigation. Why some of those family doctor practicing we couldn't answer this question as part of the project. We can just tell you what is. The average of 4 visits per position in Beaumont compared to the provincial average, which is much more 1 visit per position, per year, per person per position. So we're not saying it's good, bad, or otherwise. We're just saying it is, and it's contributing to, you only have a certain number of appointment blocks in any given calendar. And if they're taken up by multiple visits, it by nature precludes new visits. Lastly, on the accessible transportation, it's really easy to write a recommendation on this, but I know transit infrastructure is not a simple thing to go about building. But we did hear loud and clear, especially from the seniors demographic, without the ability to get somewhere, it's very difficult to make those connections, let alone the availability of times and spaces. Yes, you can technically go within 15, 20 minutes to another healthcare provider, but if you can't get there, that's going to preclude that, and it could lead to just a domino effect of not having health needs attended to, and then different population health outcomes that ensue from that into the negative. Yeah, I think the other piece is just fall into the public accessibility. This is when we're talking about accessibility for persons with disabilities, looking at this accessibility components of existing infrastructure, which either may need financial supports or grants to be able to help retrofit. But it does dovetail into things that the city can do, which is looking at the bylaws, the requirements and development permits. Like, are we making sure that the next generation of infrastructure is actually built to those standards so that we can deal with that problem over the long term and have future infrastructure that's already ready and accessible. So that's why it's put into the mid and longer term. Can't solve it overnight, but you can pay attention to the problem it presents now and hopefully don't make it worse over the long term. So we've gone through that fairly quickly, just as far as an overview of the findings and the recommendations and how it lays out on an overall timeline. Happy to take some questions, have any discussion and items that come forward here.
Good. Thank you very much for the presentation. The information in the report is extremely valuable. A lot of information there, a great report. Thank you for your work on this. And the work has just begun now. So I will just remind council that this evening, our purpose is to ask clarifying questions of our presenters, how the data was gathered, how you made the assumptions you did, that kind of thing. Administration will be coming back to us in 2 weeks with an action plan. The squads will be coming back to us saying, based on the report, here's the proposed action plan. We start talking about our priorities, proposed solutions for us to do. So tonight's more about clarifying, not debating the value or where we go next. So with that in mind, with that preface, I will open up to members of council for questions, starting with Councillor Penrod, followed by Councillor Barnhart. I'll be mindful of Ms. Moranin about anybody online, whether Councillor McCook or Councillor Monkoff swing the question. So I'll go to Councillor Penrod first.
Thank you, Mayor Daniluk, and thank you for the clarification on our role here tonight. That's helpful for me as I decide which of my 4 million questions to launch at you tonight. So thank you very much. Obviously, a lot of work has gone into this, and I appreciate the work that's gone into refining it and making the report digestible, not just for us in this room, but for folks that are downloading it and having it going through it this week. I know there's a lot of interest in the broader community on this subject matter too. So thank you for the professionalism that you all have brought to this. In fact, I might invite Mr. Richardson to come back next week when I've got a notice of motion on the table to discuss some of what you suggest that we get after. So you explained things very well. I noticed that one of the common themes of the report is that this report isn't the end of the work, that there's lots of continuing conversations that need to happen, including continuing to gather data, dig into it, interpret it, and that. So I appreciate that. I did want to start just by drawing attention to figure 5. And the page numbers get they're a little different depending on which version of the report you're looking at. I'm looking at figure 5 on page 20 or 17, again, depending on which numbers you're looking at. But it talks about what I always like to start with community assets, and it talks about some of the strengths that people perceive. I was blown away that 100% of people in Beaumont feel safe here, at least the ones that were surveyed, and were connected through this engagement process. I guess that doesn't surprise me because I know that we pride ourselves in having a safe community where people feel connected. That's just such a great strength to have, right? When people feel connected and safe, a lot of options are on the table then to improve things. So, and then the access that's mentioned there too, I think is helpful. It's maybe was a bit surprising to me, actually, having lots of family and associates that are working in sort of that primary care level of health services. The by-election that happened just this fall, the number one question I got asked was, do you know any doctors that are taking patients, right? And so I was impressed to see actually that we're at or above slightly the provincial averages there. So I do want to come back to a piece of feedback that came to me kind of on the doors and in the early days of the survey, is that there were some significant concerns about methodologies. And so just wonder if you could speak to the design of the initial survey and your satisfaction with the level of engagement that you got. I think we got about 1,000 respondents. Where does that put us with regards to how usable this data is and how solid it is, how reliable as we make plans going forward?
Yeah, the survey was intended to provide a venue in which general public could, see the questions and provide response. It's gathering feedback, but I would not put it as statistically reliable. So to undertake a statistically reliable survey would be a much higher threshold and being actually much more deliberate in what we're doing. So this was a rather passive survey. Here it is, it's available. People can go and respond to it. There was a lot of public awareness that was done through both, from the city's website, some of the communication channels, and also some of the partners and engaging with the library as well, to give people the best ability to be aware of it and then to provide their responses. There's demographic questions where it allows us to sort and sift based on respondents. What does it look like? But if you were to do and wanting a statistically reliable, so that if I asked any Beaumontonian in this question, I'm probably going to get the same answer that I see in the survey. That requires a different methodology than what was used here. So the way that we did it for the report is that was one channel that we could gather feedback from the public. It's of interest. We broke it out with also doing the stakeholder engagement directly. So through interviews and focus groups to test, this is what we heard in a survey. Does it prove true when you talk about it in a bit more detail? And then we looked at what does the data say? So that's where you had a couple of those key findings, especially around the access to mental health. So the AHS survey, which is referenced in the report, actually shows the inverse on those responses from a 2022 survey in AHS compared to what we heard in anecdotally from the public. And then when we looked at the asset mapping and seeing there's actually quite a large number of service providers, the inference is that perhaps the issue is awareness, not actually provision. But with the caveat, recognizing limitations of the method and the approach to the project, we did not go to the next level where we could talk to each one of those mental health and addiction service providers saying, how many appointment slots do you have? How many are taken up? Do you have any waiting lists? So that would be the next level of piece, but we can at least do a refer or a reference to what is a provincial average and how does that compare to the city of Beaumont? And it's not sitting that it's significantly, pardon the colloquialism, it's not out of whack. So there's not a big flashing red light on it going, whoa, here's something to be able to look at. It seems consistent. We have a different data point in another survey. There's people saying, no, I think it's pretty good. And then we're hearing in a couple other places that there's a lack of awareness in a couple different streams. Ergo, that's probably the nature of the issue initially. Handle that, then see what happens. But note that as you grow, you can't keep that number of service providers stagnant either.
Yeah.
Does that answer your question, Councillor?
I think so. You spoke to it well. Thank you. So two more, one really quick and one a little meatier. So just a note on at 4.1.1, strengthen access to health and social services. You note that as per Appendix B, there's a total of 118 local health and social services. I may be getting this wrong or reading that wrong, but if you look at the page immediately above that, you talk about, you break that number down. I think these two numbers are attached to 7 primary care services, 20 other medical services, 59 healthy community services and social supports, and 22 continuing care services. So unless there's a number that's excluded, those numbers add up to 108. So just a piece to ask, maybe just double check that there's not a typo here, or maybe just make it a bit more explicit where the 118 is coming from if we're missing some units there. And then my
Yeah, we'll take that
last,
away.
appreciate it. My last one is, if I can find it. Yeah, so it's just around the chart or table 1. Again, this is page 25, or your numbering, I think, is 22. Table 1, service gaps and availability based on health and social services inventory. Just wondering if you could speak to some of the methodology around how technical is that word available? Who determines it? So for example, ambulance services. In the chart, you say there is an AHS EMS station within Beaumont. Yep, there is, but if you talk to the folks that operate it, that bus at least is in Edmonton a good 70% of the time. So, and I think there's some arguments to be made around a few of those different slots around available, how available is available, I guess is what my question boils down to. Thank you.
So speaking to, I think a lot of this kind of points back to the asset mapping piece that was done for the purpose of this project. And most of that piece was carried out essentially by U of A, Masters of Public Health students who had this as part of their project. And essentially when determining what is available versus, unavailable in the community is just trying to identify by a sheer count of those services, what's available within a 15-kilometer radius to the city center. Of course, recognizing that within scope of this project, was not, as James was pointing to, calling up those service providers and calling up, other services that were listed on that table to see, estimate what level of capacity they have to respond to the demand. That did not fall within scope of the project, but really what we were trying to figure out was based on a sheer count of what's on that asset map. How does that compare to provincial average in terms of availability? Is there a red flag there? And if so, it would have been pointed out in the report. I hope that speaks to your question. And I don't know, James, if you had anything else to add to that, but.
So we have the EMS data from AHS on usage response times.
Yes.
So do we speak to that, I think?
Yeah, absolutely. Yeah, we had also sourced some data from city administration. I think there was also collaboration with Alberta Health Services there, just in terms of what's available EMS wise, what are the number of calls that were made, going all the way back from 2018. So that was sourced, yes, through the city administration.
Thank you.
Yeah, you're good, Councillor Penrod? Okay, thank you. Councillor Barnhart?
Mayor, if you wanted to go to Sam, I noticed he had to leave early, he said.
I'm not
Just
that I'm
sent
aware
him.
of.
Do you want to see if he wants to go? before-
Sam, do you want to go next?
Yeah, thanks, Kathy. You go ahead. I've got a bit of time here. I appreciate you flagging that.
Okay, so Sam, go ahead, please. Thank you, Councillor Barnhart.
Yeah, thanks. So maybe just very, very quickly, just to pull us back a little bit, how do we get here? And first and foremost, obviously we're looking for something to come out of this, right? But before we can do any of that, we need to collect the data. So thanks for all the work to get their very thorough report. I'll say, going through and looking at some of the recommendations, there's a lot of regional collaboration, advocacy, increased transit, all that sort of stuff, and not too much kind of hard steps, I guess, to get to where residents are really looking for, which is what you've identified in the needs. So maybe just a question for administration, because I don't want to take us down too far a rabbit hole here. The report, and Cass, probably for you. So the report that's coming back in a couple of weeks, could you just maybe outline a little bit about, what's going to be in there that's kind of tangible for us to look at? I know we've had discussions around different options for tax relief, all that sort of stuff, to try to encourage folks to get here. So just maybe help me understand what we expect in a couple of weeks, and that'll determine kind of my questions tonight.
Ms. Squires, your mic is on.
Sure,
It's on.
Sure. Thank you, Councillor, through the mayor to Councillor Monkoff-Swain. The report that's coming back on April 9th, we're calling it the Health Services Action Plan. And what we've done is taken the recommendations from MMP's report and looked at it from what is our municipal role to deliver the recommendations and still address all of the gaps in services that were identified by MNP and AHS. I've also been working with Alberta Health Services on this action plan to make sure that what we are recommending as steps for the municipality to take will be received well. As you mentioned, there is going to be a significant amount of advocacy that needs to happen on this file with our neighbors and the health delivery organizations. I'm not sure what to call them right now because they're all changing, but so those steps will detail resourcing, timelines, who are the leads on those action items that are coming out of this report, and what steps we'll be taking to make sure that each of these action items have a tactical element to them.
Thanks. That's perfect. You had me at the title of the report. Action is what people are looking for. So thanks for that. I don't think I've got any further questions. And Bill, I'll wait for that action report and look forward to hearing that. So thanks again to the team from MNP. Great report. Really appreciate all the work.
Okay, thanks, Sam. So I'll loop back to you at the very end in case you're still on. If you have to leave, though, just go ahead and do what you need to do. Appreciate that. I'm going back to Councillor Barnhart and then back into the order again. So Councillor Barnhart.
Thank you. Thank you very much. Yeah, it's been said, it's a lot of information here. And I'm trying really hard to put it into something cohesive here in terms of what question to ask. But the one that keeps coming up in my mind is where I think Councillor Monkoff-Swain's talking about where the dots are lined up. Where does it intersect with the other plans that we have in place? So I know you reviewed the social master plan, and I know there is definitely we know there's a need in building up our supports. FCSS is not set up to deliver social services, it's set up to deliver preventive social services. And yet we always go back and say, we don't have capacity. Well, it's not set up to do that. So we have to look at some of the other agencies and how can we support them as well. So, I saw FCSS transit, which we are trying very hard to address and are doing very well in that, and awareness as being within our scope in terms of a municipality, what we can and are trying to do. I'm trying to frame this into a question for you, because maybe it's the administration that I'm asking, but can you maybe highlight what other reports and what other documents you've read where you see that intersection? I know the social master plan is one. Have you looked at other strategic plans that we have in the city of Beaumont to see where we can really make a difference here? Apologize for the question. And if you want to change it and answer with whatever you have in mind, go right ahead.
Well, I'm going to have to give you an answer that may not be giving you the response to your question. And the reason for that is, yes, we did look at those other plans as part of the documentation review, but our purpose of reviewing the documents was actually to pull out some of what the current assets were. So from the implementation or where it intersects with other plans, to me, I think that's something that falls after this first phase. So that's going to be looking at the feasibility and then, driving to with other strategies and pulling the resources with some degree of alignment and consistency and coordination to achieve those objectives. So it's not quite part of the scope, and I couldn't give you a very good answer based on the way that we looked at those source documents to be able to get at, I think, what you're looking for. If I understand correctly, how are we going to make use of other thinking, other plans, and make good use of resources to drive forward to achieve the objectives? And I think that's what you're going to start seeing from administration based on the needs analysis that gives us good evidence to say, where do we need to pay attention to? What are some of the big burning fires? I want to use that type metaphor to start first, second, third, next, and afterwards.
Sure. And I
Councilor
do
Barnhart,
think
if I may, sorry, Mr. Shores, you want to jump in on that point?
Yeah, I just
Thank you,
wanted to, and James is correct, a part of the next phase is going to be amalgamating those plans and those actions. And part of the recommendations that will come back in 2 weeks is going to be a resource review. Because like you said, there's not only resource availability, but expertise that we don't have. So we're putting together a master document, I don't even know what you want to call it, the strategic, that pulls those social related actions from the other plans, and it will become part of how we're the roadmap to get there.
Perfect. Because I think the last thing any of us want is to start from scratch, because we've done a lot of work
Absolutely.
in this regard, and we do keep hearing some themes that are repeating. But again, resources is one of our challenges, and where we put them is certainly what we're trying to make sure we do. One more, Mayor, I think, and that's regarding housing, which I know quite well because I chair the Duke Regional Housing Board. And I don't see the affordable housing unit in Beaumont listed here. And I don't know if that's just timing or what, but it's been in existence for a number of years. I would think that, again, having affordable housing in our community is really helpful. Again, you have affordable housing, you need to have the social supports and the services that go along with it. You've mentioned one of them, but not the other. So I just thought I'd mention that for you. Villa Beauregard, I think, is the one. And yeah, I think the other, we really have done quite a bit of work on this, and awareness. From my point of view, there's so much information out there, whether you look internet wide or whatever. I think the problem is not knowing it's there, not knowing where to look for it. I don't know the answer to this, but I do think that we assume we know, and then someone says, "Oh, did you know?" And you're like, "No, I didn't know." Like, there's just so much. And if there's any best practices on that as to how we as a municipality can address that, sure love to know what those are, because that's number one. And communication is of course key here. So yeah, I'm sorry, my questions are more rambling than I'd like them to be, but there's a lot of information here, really good. I'm really looking forward to seeing the next steps. Thank you.
Councillor, I think that what you're speaking to is inherent in one of the recommendations, was looking at building that awareness, and the other words around that would be building a communications plan, and building a communications plan is part of going from feasibility. If we agree it's a priority, we're making recommendations, they have to be accepted and decided upon. But if it's seen as a priority, if it's feasible to undertake, if you have the resources to do it, the piece that you do for building a communication plan is, what are we trying to get across? Who needs to know it? And then what are the ways that we can do that in the most efficient way? And that's, I think, one of the things you can expect to see from administration. Our interaction, you've got a great communications team. I would expect that can come out of it. Fitting in with what's the city's role? What is the role of repeaters in the community, which is the other providers? FCSS would have a role in that on a referral, or when they're interacting with folks. If it's not us, I can tell you who it is. Building that awareness and lining up the right supports and services with the needs as they present, if they already are part of the asset profile, is going to start to make a difference alongside all the other recommendations that were there for other needs that have different actions associated with them.
Thank you, Councillor. Appreciate that, and the answers from our presenters. Next up, Councilor Telebus, followed by Councilor McCook, followed by Councilor Van Newkirk. Councilor Telebus, you have the floor.
Perfect. Thank you, Mayor. And I know we're repeating this, but we are really appreciative across the board here for the report that you provided. A lot of effort went into it, as we can see, and a lot of information to consume. For those of the public who haven't gone through the full report, it obviously captures a lot more detail than the quick overview that you guys provided. Just a quick question in terms of, I guess, the research and the collection of data that you guys have completed. I personally know and can see what the value is, but are you able to share, I guess, kind of with everyone what you feel the value is in investing all this time and resource into obviously finding out what the needs are and then progressing to some recommendations? But I think more so just want to focus on the collaboration you had with Alberta Health Services and potentially how that could be an outlier or a difference maker in our favor, I guess, to.
Well, you saw that many of the recommendations that are in there have to do with the advocacy and interregional collaboration. When moving through such a process, evidence and data can put the conversation on solutioning as opposed to comparison of validity of opinion, my opinion versus your opinion. It's that this is what the data says. This is what the evidence presents. Now, what are we going to do about it? I think that's the advantage that an evidence-based, decision-making and exploration process provides. And so, yes, there's a greater investment in time and effort involved in doing so, but the expectation would be it can facilitate a smoother process. It's never smooth when you put a number of players in place and to do it, but a smoother process that is solution-focused because the evidence is agreed upon.
Councilor Telebus, before we go any further, Ms. O'Neill wants to jump in on that point from administration and help clarify the answer for you. Ms. O'Neill.
Thank you. Through the mayor to Councillor Natellenbos, I just want to add on to what James said is when we met with the health authorities, having a completed health needs assessment was a critical step to getting any advocacy efforts or government relations underway through the Ministry of Health. This document is critical. Thank you.
Perfect. Thank you for that. And kind of tying to this, and I'll just throw out a little pessimism here, but more so in realistically, I mean, we have a national healthcare crisis, provincial healthcare crisis. How are we any different than our fellow neighbors, let's say across Canada, in terms of prioritizing our needs versus theirs? Like what could be a difference maker? I know we can't, or we're not proposing solutions right now, but just in terms of, again, some of the data you've collected, and maybe it's the report itself, like we explained, but what could be a differentiator from us, from the next community, and in the steps we take forward, I guess.
Do you mind if I answer that more from an experience base, and it's not actually from specifically in the report? It's referenced, but in my experience, and especially 25 plus years in public sector, working with governments, working with different policies and programs and development thereof, especially in Alberta, and it's actually prevalent across the country, when it's more than just one single place, especially when you get into other orders of government, it's easier for them to start putting resources around exploration, decision, and development, because the impact that you're trying to achieve now extends beyond a smaller unit. That's why there's emphasis on the intergovernmental or inter-regional collaboration, because it's not isolated here. We've got a really good view, from having done this health needs assessment of exactly what's happening in one particular part of it. I think you can extrapolate beyond that. You're right in that we're hearing, all of us are hearing across the country, across the province, this is the healthcare crisis that exists in many different formats. But bringing together more collaboration, creating a larger pool of impact for the development of policies, plans, or otherwise, can be a difference maker, not just for yourselves, but actually for all of the residents and all of the population that's actually going to benefit from it. So does that answer your question? Or
yeah, no, it does. And I appreciate you kind of going out of context and using your personal experience to share that.
Councillor, one more administration help from Cassandra. Ms. Squires, please, you want to jump in on this one too? And I'll come back to Nathan for a follow-up.
Yeah, I apologize. I don't want to keep interrupting your questions, but through the mayor to Councillor Natellenbos, My experience with Alberta Health Services is that they were only working with one other community in the entire province to undertake a community health needs assessment like this one. I would say that this document sets us apart, that we have a lot of data we were able to get from Alberta Health Services, from EMS, from the Leduc, Beaumont, Devon, PCN, that we were able to validate a lot of the concerns. And I am not sure that other communities in the province have had that same opportunity. And so I think working so closely with that team and knowing that they've only done this with one other municipality in the province, I think is going to set us apart when we go to have conversations and have actionable steps in front of us. Thank you.
Perfect. Thank you for those responses. I'm one to sometimes question investing all these resources and finances into scenarios like this, research like this, just because I don't know that you always get the value that you think you will. But this would be a scenario where I would say the opposite, and I feel that there is a lot of value, and that's been shared amongst you guys and everyone else. So appreciate all the hard work and look forward to some recommendations or action plans come April 9th. So thank you.
Thank you, Councillor. Councillor McCook, you have the floor.
Thank you, Mayor. And as everyone said, obviously, thank you for the presentation and thorough report, and kind of highlighting the role of municipality in the healthcare piece and why we did this needs assessment and how it's essentially, a gap, and helps us tell us what our needs are and where we need to go. I also just wanted to highlight in the report the data on the availability of transit services supports the call for more availability and accessibility for transits offered to Beaumontonians. Obviously, our transit system is far from perfect. We're on our way to doing a little bit better, but transit's not always a popular topic for people, but it is clearly a need in a growing community, and it's imperative to a healthy community for both social and economic reasons. So it was good to see that in the report. I think most of my questions have been asked, and most of them are probably clarifying and likely lead to the action plan piece. So I'll be quick. On the piece of the social supports lacking for people with disabilities, seniors, and 2S LGBTQIA+ community, did you explore which ones, or will those specifics come with the action plan?
I'm going to pass this to my colleague Cass here.
Yes, so we did hear a number of specifics which are outlined, I would say in the report, understanding there is a lot of information to sift through, but happy to speak to some of those. Specifically what we've heard from the Growing Families group is families are often struggling with how to ask questions and where to go. Oftentimes new parents are facing some navigating challenges, being able to form a sense of community and knowing where to access those resources. So from that perspective, that was one of the main social supports that they were looking for. As well, speaking to folks that are part of the LGBTQ community, from what we've heard is, specifically looking at, again, forming that sense of community, knowing where to seek out resources, how to come together kind of as a group, share common experiences, and also have, specific resources that are, again, very specific, mainly specific to the needs that speak to that community. So, looking at therapy or group, group access to group therapy sessions oftentimes was what came up. So there's a number of different things. One other thing I'll mention as well is, we've had some early childhood educators that spoke to, sometimes it feels like needs have doubled since last year when it comes to mental health supports, people that are seeking access to affordable housing, people that are using the food bank That was a main theme that came up. So again, just some of the key highlights that I wanted to point out, but I hope that speaks a little bit to some of the detail, the level of detail that you were seeking.
Yeah, that's great. Thank you. Yeah, clearly, I think that a lot of complex needs are arising that need to be sorted out. Just one more, and I presume this will come with the action plan as well. It stated a creation of a more inclusive environment and additional supports for people to participate in current neighborhood and community events to increase social cohesion. That's something that we'll see in the action plan. Perhaps this is more for administration.
Squires?
Mayor to Councillor McCook. Yes, that's correct. That is an item that will be addressed in the action plan.
Okay, perfect. Thank you. And then just one more so just potentially for people listening. It was stated in the presentation that there was a gap in referral coordination between family doctors and allied healthcare professionals. And then data on the number of referrals was provided. So how was it determined that there was a gap? Were there referrals that were made but not completed or followed through?
There's two parts of it. One is anecdotal, and that was based on engagement with the healthcare professionals and noting that even from primary care, not full awareness of all of the different allied health professional sources they could refer to. So that's anecdotal. The empirical or numerical base, yeah, we listed the number of referrals that we saw. And what the remark there is, with 69,000 plus unique visits to primary healthcare providers and seeing small numbers like 234, but referrals to such things such as that would be fairly common, dietitians, perhaps other specialists. That's incredibly low, which indicates it seems to support what we heard anecdotally from providers, that there's not enough knowledge of what exists. Therefore, we're not seeing a high number of referrals. Does that answer your question?
Yeah, it does. Thank you. So just to clarify on that piece, that would be part of the advocacy piece through to AHS to kind of help them also navigate that better information needs to be out there for doctors and healthcare professionals to be able to refer to each other.
Yeah, I think step one is identifying the problem to solve. And that's what's been identified here. Like, there's many pathways to solving it, and that would be one of them for sure.
Perfect. That's it. Thank you.
Thank you, Councillor. Councillor Newkirk, you have the floor.
Yeah, thank you. A lot of good discussion tonight. A lot of information in the report. I just wanted to try and connect a few dots here. So regarding the health and social services inventory, I wasn't at all surprised to hear the feedback that you got from the community, that the community didn't understand what we had. That is in direct alignment with what I've heard from the community on feedback, particularly around what we do and don't have even in the community services realm. Folks will identify that they have a problem or we have a problem and not know that there's a service that addresses those types of things. So we've continually had that gap in the municipality in the community services realm. And I've brought it up in this room. Administration won't be surprised at all that I'm saying this. I've brought it up in this room a few times that we don't know what we have sometimes. So I'm very encouraged that it was brought up again here, just from the aspect that it's going to, again, put the lens on that. And the asset inventory that you folks included in here, we need to cut and paste that and sprinkle it throughout the municipality, right? Like, here's all the resources. Look at what we have, right? So it doesn't take away from what we don't have, and that's why we're here talking. So it was interesting to see that the mental health portion was identified as a want rather than need, and I listened intently as to how we got there. But it actually directly conflicts, and I'd just like you to speak to this a little bit. It directly conflicts with the page 22, which is the community health and wellness, the assessment of medical issues in the community, because that's, the survey was all about perception. What's the perception of your health in Beaumont? What's the perception of the health of your neighbors? What's the perception of this, perception of that? Then it pivoted and said, tell me about you tell me about what you know, what you don't know. And in there, the seniors' third bullet point down was mental health issues. Growing families' top bullet was mental health issues. Healthcare providers' top bullet was mental health issues. And people with disabilities' top bullet was mental health issues. Now, you could put me at bay if you said they weren't prioritized in order, and maybe that's the case. But just being that that bullet point is present in that chart hierarchically, maybe if you could just speak to that a bit of how we ended up as a want instead of a need on that one specifically. Do you understand where I'm going with that?
I think so, yeah. Christine, do you want, I can talk to you, but you
Sure.
haven't had a turn yet.
Oh, you go, I'll jump in.
Okay. Thank you for the question. I think there's a couple of dimensions to that. So what you're referring to is correct, where that came up from asking the question through the survey and the engagement. So yes, that is the primary perception that's coming up, and it was remarkable that that showed up as number one for many of those groups. What the reason why it moved to a want as opposed to a need is when we compared it to the other pieces of evidence that we had. So part of it is the community health and wellness indicators for the local at the LGA that the AHS had done. That was inverted when asked, and there's a higher number. There's a higher number of people that responded to that about what they feel their ability to cope, their ability to thrive, and some of the mental health indicators. Compared to what we heard. So well, Beaumont's actually ahead of the average. That's interesting compared to what we heard from stakeholders. Then we looked at, okay, well, maybe that was 2022 from the AHS survey. This is in 2023. They were asking this question on the survey, smaller sample size that chose to respond. We looked at, okay, what are the assets in the community? Is there a low number of providers? So if I'm someone who's looking for that service and I can't find it because it doesn't exist, that will be exacerbating the issue. But when we looked at and cataloged the number of providers and looked at compared to a provincial average, it's like, no, there seems to be a decent number of providers. With the limitation, we could not go into the how many appointments do you have a waiting list, all those kind of things. So it's shifting it from a want to a need. Not that want is a bad thing, it's just not as high of a priority as those that have been assessed as a need, because there's a gap on the ability to provide services against the presenting need that's there. So in summation, yeah, we heard from the stakeholders, there's a perception there. The evidence doesn't quite back it up for the pieces that came through the methodology that we used. And there are other more pressing priorities that seem to present itself. So want the detailed recommendation saying, here's how you can go further discern, but it doesn't seem to be as pressing as to what we originally heard in the initial stakeholder engagement.
Yeah, no, fair. I appreciate the more color on that, because the perception directly conflicts with the data. Earlier on, one of the comments was hit by Councillor Penrod, but one of the things I'd flagged is that the asset mapping doesn't actually speak to available capacity, and we've already hit that nail on the head. And I think when we dive into the available capacity around assets, I think some of our findings might shift, and that probably is work for another time. It wasn't scoped here, right? So a question that I genuinely don't know the answer to. How do our schools fit in? Health services and supports available within schools. You have school counselors, you have school resources, you have those as places in the community that students would go, not for, boo-boos, right? But for advice, for support, for, the stuff that school counselors do, because some of that work does supplant other mental health needs or tools in the community, and that health services and supports available within schools isn't identified as an asset here. Could you maybe speak to that? Is that something that is commonly included or commonly excluded, or how does that look?
I'm just thinking how I'm going to answer this one. So I think typically we would see those assets as sort of external assets assets, especially when we're looking at the social determinants of health. So we would look at housing, we would look at education, we would look at economic development. For the purposes of this project, we didn't go that far as to looking at school specifically and the services and programmings and things that they would offer. Where it would have come up would have been in the focus group that we did with the growing families. But my understanding, and Cass, tell me if I'm wrong, a lot of the participants in that focus group had younger children, and so we're speaking more to programs and services, sort of from that infant to I want to say like kindergarten age group. There wasn't a lot of participants in that one that would speak to sort of school aged kids where that would have come up for us to add into sort of the asset mapping as a piece of that. So I don't know if you want to add to that, but.
Yes, this is definitely something that we've thought through, just thinking about gaps that were identified by the community that speak to those social determinants of health that Christina was speaking to specifically. When we talk about wraparound services, when we talked about a comprehensive approach to health, of course, education plays an important piece to that. And, that is certainly something that's important for consideration. And, we have had a couple of comments come up about some useful services that are provided by a particular school division here in Beaumont, and the fact that, there's some appetite for increasing the number of preschool programs to combat long wait lists. But exactly what Christina spoke to, I think we needed to define those parameters around what we consider to be a health service that was available to community members, recognizing that there's always room for further exploration to speak to those social determinants of health.
Yeah, thank you for that. And at the beginning, I alluded to connecting dots, right? And one of the decisions we made on council a few years ago was to support a school resource officer, right? So what I'm pointing here more to is, we talked about inter-regional collaboration. We've talked about regional collaboration. We should probably talk about collaboration among the groups that are in Beaumont. And if you want to ask things, you go where the people go, which is what you did in this survey, right? But if you want to figure out stuff, we know that there's all these kids in school every day, right? And so what piece of the puzzle and solution or action that's coming up, moving forward, is there an opportunity to collaborate with the school divisions on, right? That's one of the things that's permeating through my head as we look at this action list, because we know all the kids are in school every day. We know some kids feel more comfortable at school than they do at home. We know these things about our youth and how they grow and where they grow up. And so I think that thinking through that as we look to our action list on April 9th, we need not overlook that opportunity. So I'll be done there, Mayor. Thank you.
You're good. Thank you, Councillor. Okay, unfortunately, we had a bit of a technical problem that put us behind schedule. We have a short break plan, and we have two topics, and we have presenters coming in at 7:20 for the next session. They're outside presenters, so I've got to cut things off. Sorry, Councillor Pinard, you have a question there, but no time for round two tonight. So again, thank you for the presentation. Huge amount of information, much appreciated, and we'll be seeing you again in some way or form. I'm sure Ms. Squires will be coming up with the action plan next couple of weeks. Looking forward to that as well too. So again, thank you for the information. It was long time in the making, but very much appreciated. I thank you for your time. With that, we'll take a 10-minute break, come back promptly at 6:46 to start on our next topic, which will be our Places in Play Recreation Master Plan. Looking forward to Mr. Suter presenting that in about 10 minutes time. Thank you very much. We are. I only got about half done. I figure I better stop. Normally I'd be done in 20 seconds normally. We're live. Good evening, everybody. We're live back after our short break here at 6:51. Kat, you're on the line. Make sure you can hear us okay. Or Councillor McCook, sorry.
Yes, I'm here.
Thank you. All right, we'll continue with our agenda this evening. Item 5.2, 2024 Our Place to Play Recreation, Parks and Facilities Master Plan Update. Mr. Suter, I believe you're presenting this evening, and you have the floor, sir.
Thank you, Mayor. Good evening, committee members. I'm Paul Suter, Director of Community Services with Beaumont. I'm very pleased to be here this evening for a first time, I guess, comprehensive high-level view of our Places in Play Recreation Parks and Facility Master Plan update. The work on this plan started back in 2018, progressed through 2019 with Expedition Management Consulting doing the bulk of it, speaking to the community in a variety of ways, and the report itself was then finalized and adopted in January of 2020 by City Council. I recall back then when we looked at that report comprehensively, it was Councillor Barnhart that asked me specifically, do you think you guys are going to be able to pull this off? There was a lot in there, clearly. And my answer at the time, trepidatiously, was we believe we can. And since that time, we have been very busy. We're not there yet. The plan is a 10-year plan. We're coming up into this is year 5 of actual operations of it, delivery of it, implementation of it. And it was a good point in time to check in with committee and council on what we have been doing and how we've sort of got there. By no means am I going to bore everyone with line by line here tonight. As you can see, there's a lot in the plan. 3 main pieces being operational items, resource needed to deliver those, as well as capital items, both short-term and medium and long-term. When we look at this plan, a lot of master plans, the rub on those is they get adopted, everybody likes them, and then they get put on the shelf. I don't believe that's the case with our Places in Play. This master plan, in my mind, has affected and touched every area of our community administration-wise and outwards. And it is a very much a living plan, if I can use that verbiage. And when I say that, I mean because we reference it constantly. We reference it in our reports back to council on items that we are asked to bring back or things that we're asking for. We reference it when we're working with citizens. We reference it when we work with user groups, as well our committees, both the Rec Advisory Committee, Rec and Culture Advisory Committee, our Arts Advisory Committee, anything that we can reference back to our master plan, we will. And the real reason there is to build knowledge of it, as well as make sure that it is not forgotten and that we're ensuring that the recommendations that are in there that were sound at the time they were made can be delivered and actioned. Not to suggest everything has been delivered as it was originally recommended, and there's a variety of reasons for that. A lot of times it's resourcing and priorities. When we go through the budget process, administration looks at the capital plan, for example, through the capital budget workshop group, flows through to senior leadership, and then comes in a proposed budget to council built into the capital plan. Some of the stuff has been brought forward, some of it has been pushed off for a variety of reasons. Operationally, we really hit a bunch of stuff early. Thankfully, we were able to do a lot of that stuff in-house. We've only actually added in our Rec and Culture Department 1 resource since this plan was adopted. There's a variety of resources that were named as recommended to bring on, but we've only brought 1 on. We did reevaluate a couple positions internally and did create another position with existing resources a few years back to support arts and events. That has been a tremendous success, and that role has gone on to help deliver some of the items in here. When I talk about how the plan is alive, I really mean that, because it is a blueprint, I guess, if you will, for how we operate and how we think for today and tomorrow. And it's changed to some degree how we look at things. I think one thing I'd like to highlight to the committee this evening is it changed in so much as we look at collaborative ways to deliver things more and more, rather than doing in the traditional way. So whether it's a neighboring municipality partnering with us on a joint feasibility study for a joint recreational space in the future, or whether talking to a neighboring municipality such as Edmonton as to what their plans are going forward with recreation facilities, and even private entities and how that can work. One example I'd like to highlight was a community group came to the Rec and Culture Advisory Committee last year, and they were looking for some more ice time and how could we get some accelerated project done to build more indoor ice. So from that, collaborative, we looked at different scenarios. So we've been talking with a private entity about how that could happen for us. And we'll see where that materializes in the future. So there's lots of things that can change when you look at what's been recommended in here about collaboration, not doing things alone, as maybe has been done traditionally in municipalities for a long time. And I think the only thing I'm going to flag, and I'll wrap up if I can, the wants, the needs that were identified in here was a snapshot in time. And a lot of things have changed here. And we heard earlier this evening that the population is projected to grow or double, I guess, by 2040. So that significantly will change the requirements, the pressures that we're seeing for facilities and programming. I think that when you have that in mind, then you have to go back out again at some point and see where we're at. We do get ongoing annual updates from our user groups and what the pressures are, both in terms of just conversations with them, as well as through the allocation process. And we look at how best to meet those needs in the interim. There's obviously a lot of money involved when you're talking about more erect facilities in the future. And that's affected likely how the capital plan has been adjusted. I did have a brief PowerPoint. If Shaima, you could throw it up there for me. I just got the 2 slides I was going to key on, and I'll wait for that. You won't be able to see it very well, but I think, Council, you've got it on your screens as an attachment. The capital plan, everything that's in black under the years was what was recommended at the time of adoption of the plan. Everything is red is what administration has addressed or is trying to address. Likewise, the next slide is the operational plan from 2020 to 29. Same thing. The black was what was recommended at the time, and the red is what we have done or planning to do. Additionally, we have pushed it out to 2033 in our 10-year capital plan built from last year at budget, and some of these items are captured there. So some stuff you won't even see that was pushed out further just from a priority perspective. And I think, Mr. Mayor, that's all I have got at the moment. If there's any questions, I'd be happy to have them. Thank you.
Thank you, Mr. Suter. Appreciate that. The report was very informative on our agenda here. Thank you very much. I'm going to go to Councilor McCook first for the first question, and then I'll go to members of council in attendance this evening here in council chambers. Councilor McCook, you have the floor.
Thank you, Mayor. I'll be brief. Thank you very much for the update. Clearly, a lot of work has been done on this front, and due to our growing community, a lot of ongoing work to continue. And we've, as you laid out in recent years, there's been quite a few investments in rec, and these facilities are also heavily utilized by our community, which is great to see. I also just wanted to highlight and commend you, Mr. Suter, and your team on your efforts for collaboration and in finding resources within the organization. I think sometimes people think that collaboration is easy and everything, but it isn't always. So I commend you for those efforts. Just one question on one of the graphs that you had sent us. I was just wondering if you could explain a bit further. It says, accessibility audit was complete in 2023, showing areas of opportunities the facility could improve without further resources. Implementing new accessible programs is not feasible. Is this different to some of the adaptable programming, which we have spoken about recently, which I thought we were going to integrate into some of our regular programming?
Thank you for the question, Councilor McCook. It is different. These are some bigger picture items that we would need resources, both in terms of human resources, as well as potentially facility enhancements that would be required to deliver additional from what we can do in-house. Yes.
Okay, perfect. Thank you. And then will we get just some clarity or an understanding at some point as to what resources would be needed for us to do some of this additional accessible programs?
Yes, we would bring that at budget time. Yes.
That will come at budget? Okay. Perfect. Thank you very much. That's it for now, Mr. Mayor.
Thank you, Councillor. Appreciate that. Councillor Telebus, followed by Councillor Barnhart. Councillor, you have the floor.
Thank you, Mayor. Thank you, Mr. Suter. I really think these plans and I guess transparency is critical. A lot of people ask questions like what, where, and how, and a lot of that's answered throughout these documents here. So really appreciate that. As quick as you mentioned a potential additional rink there, I just got a text message. So you might have to provide a little more insights as to maybe some of the things that you're exploring, because obviously that's a need for this community as well. So just a quick question. I know you only gave us a tidbit of information, and it sounds more exploratory than anything, but just curious if you could provide a little more detail on what you're thinking.
Yeah, thanks for the question. Again, it's just going back to that spirit of thinking outside the box a little bit and what opportunities may present themselves, because we know capital infrastructure is very expensive. And where does an additional ice surface, for example, fall in the priority for Beaumont, right? So we've looked at other options right now. It's just been exploratory at this point as to, is there another option, another way to look at it? And what could that mean for us? So it's very early. I'm not suggesting there's anything in the works here at the moment. Yeah.
Fair enough. Thank you. That's all I have.
Thank you, Councillor. Councillor Barnhart, you have the floor.
Thank you, Mayor, and thank you, Mr. Suter, for the update. So I'm approaching this gently because what I noticed and what was brought to my attention was that, yes, this plan included culture, and the art community sees that as where their place is in this master plan. And as you well know, I'm not telling you anything you haven't heard as well, is that we still are facing a number of members of the community who feel that we haven't completed or moved in the direction. And yet when I look at the implementation and the strategies we've done, we certainly have been trying. You've been trying. We've been putting it forward and devised a policy. We had a committee struck. We did a feasibility study, but we're not really any further. Well, I suppose we got further ahead, we have more information, but we're not really seeing the results of that in any tangible way yet. So I guess I'm wondering where to from here. If this plan really can't be implemented from the perspective of the arts community yet, do we wait until 10 years? I guess I'm wondering how do we get to the place where we need to get, which is to get the newly formed terms of reference and the arts committee thinking about what else can we do. If we can't have that, that's not the end of the world. What other spaces are available? What other programs can we do? What else can we do besides that? And not giving up on it totally, but knowing that it might be a very long time before we can put together the capital for that. So I'm pretty sure you'll be expecting me to have that question. So maybe you tell me what your answer is to my concern.
Through the chair to Councilor Barnhart. Thanks for the question. Yeah, as you highlighted there, we have done a lot of work in the background in that area, both in terms of enhancing the grant program, for example, the Arts Advisory Committee, which is kind of a reset from the Arts Council. And the hope is now that we'll get more movement through that group. As well, we've done that feasibilities, or several feasibility studies, landing with that Performing Arts Space Steering Committee final report that came to council, was it a year and a half ago, almost 2 years ago now? And the challenge is with what's there. I think we know what we want and what we feel we need. It's just how to deliver that and when to deliver that. And I think that's what people are looking for. I don't have the answer on that this evening, obviously. That's for administration, I guess, to make a recommendation at some point in the capital plan as to something that could look like. Having said that, there are other things that we are looking at now. I don't want to say use the word interim, but that's really what it could be, or at least an additional opportunity. I'm really hopeful that those conversations are going to happen this year with the Arts Advisory Committee. And when I look at their proposed work plan, which hasn't been finalized yet, but there is an item in there to speak around that. So I'm really hoping that that's where we get that traction. We're all sort of wondering the same thing, if I can be honest, about when and where and how. But I think that's still to be determined in conjunction with the other priorities for Beaumont when it comes to facilities, for sure.
It's encouraging to hear that you are as well are continuing to look at it. And I guess the answer to my bigger question is the art strategy, or strategies to provide space and programs for the arts, still fits in this master plan. There isn't another need for another plan. We can rest assured that it's not forgotten. I mean, when I see culture and I see that we've done these things that were in the plan, but there's nothing else coming that's in this plan, Is it the advisory committee's role to come back and say, we need another plan, or can we adapt to this one?
Yes and yes. It could be, it could make its way back to council in a couple ways, 3 ways, really. Administration, the Rec and Culture Advisory Committee, and or the Arts Advisory Committee. Any one of those 2 bodies in their work plan can come back and make a recommendation, both in terms of a new idea potentially, or they could look at this capital plan for the next 10 years and make a recommendation to prioritize differently. And that's what my hope is, that those conversations, in my mind, that's why those committees exist, to have those conversations, to work on behalf of council, work with us, and then come back with recommendations. Otherwise, you know, we're spinning our wheels, and we'll continue to do that if that's not what their focus can and should be. So I am optimistic that that's what we'll see, is some recommendations coming forward to help get us to where we want to go. But that's still to be determined.
Thank you.
Councilor Barr, before we go any further, Chair Schwartz wants to jump in. Some additional information on your question. CO Schwartz?
Yes, I do. And Mr. Suter triggered this for me. I'm going to offer another avenue, and that's through the financial sustainability engagement that's occurring, and more of that work starts tomorrow with the chamber. And essentially what you're going to see at the end is a list of priorities from a facilities perspective and needs from the community, and a list of how they're willing to pay for it. So that's that part of that work that we started on the overall facilities. So
if I could just say as well, and what I was optimistically hearing from the new advisory committee as I'm sitting there on council's behalf, is that there is a desire to look, in addition to, yes, performing, but when we don't know, look at what spaces in the community might we already have that we could use or could make available to different arts groups, so that it isn't just about one big project, that there's many things and many different forms of art being done in our community that need to be looked at as well. So I appreciate that that opportunity is coming.
Thank you, Councillor. Any further questions from any members of council? Councillor Penrod, you have the floor.
Thanks, Mayor Donald. I really appreciate Councillor Barnhart you raising that issue. It sort of speaks to a piece that we've talked about before, Mr. Suter, and definitely have talked about with Councillor Van Newkirk, around this concept of, you know, our sports clubs are organized and active and here and have had services and ability to get established over decades, generations even, right? And so they're better able to mobilize to advocate for their needs. And on the other hand, we know that Beaumont is an outlier, not in a good way from the arts perspective, in that we don't have that infrastructure. Therefore, we don't have the groups. Therefore, they aren't able to mobilize their voices as effectively. So really appreciate CO Swartz, you mentioning that we're doing this critical engagement work. I just hope, and I will continue to poke at this and try to help us be creative for how do we hear the folks who aren't best mobilized. And there's been good work happening on that. So I think we're not, you know, we're making some progress, albeit maybe slow, but so that's a comment. And then just a question around, we've talked about from a rec perspective, some of your ability to foster relationships and come to some creative partnerships. And I just wonder, are we talking to schools and or faith communities around, again, some other opportunities to find spaces in the community that might be interim solutions while we await that piece of real critical community infrastructure?
Yeah, thanks for the question. Through the chair to Councilor Penrod. We have had some conversations with both of those in the past. Sometimes these things, they're happening, but not everybody's on the same page and not everybody's talking to each other. We've seen that. And that's our effort. One of our operational goals this year for the Rec and Culture Department specifically is to build a capacity with CVOs and support them in whatever way we can. So that's already in our top 4 goals this year. And my hope would be then those conversations can be at least focused so that everybody is on the same page, because if there's 3 different ideas going on and they're all pulling in different directions, we're not going to get anything done. So that's the first step of that idea, is to get everyone in talking same language, and see where we can go. Because there are other options. There's other options potentially that could work. Some of the stuff we've looked at in the past just wasn't the fit, wasn't the right time, a variety of factors, things just couldn't happen or wouldn't happen. So I hate to use the word reset, but I feel like it's a bit of a reset with the way we've restructured with our committees and the focus and what their mandates are now, and some of the energy we've already seen and the ideas that have already come out. And when they come to report to council with their annual report and what they want to do this year, I think you'll see that. So I am cautiously encouraged with where we're going.
Thank you, Councillor. Any further questions, members of council? I would say one quick comment. I want to thank Mr. Suter for his presentation, the information we provided. We've come a long way in our work in this department, and I want to thank you for that. One municipal collaborative, our friends and colleagues in Leduc County on their county council administration are very supportive of our efforts to support recreation in our city, because many of the residents use our city for various facilities, including the arts community. So they're very, very cooperative with us and looking towards our vision for the future for our capital plans for recreation and culture. So kudos to our Leduc County friends and colleagues there, because they do support us and they're very open to our ideas for doing new things. And we meet with them twice a year. Councillor Partner and I are on that committee. We meet twice a year with Mr. Suter and we talk to them about what our plans are for capital. And they do contribute capital money to our sources, such as our rec center. They contribute significantly to our rec center, which is why the field house is called Leduc County Field House, in recognition of that partnership and going forward collaboratively. So thank you again, Mr. Suter. Seeing no further questions, I'll ask you to thank you for your time this evening and move on to our next topic. Next on our agenda this evening, Council and Administration, is 5.3, 2023 year-end financial report. Mr. DeBlanco from Finance is joining us. Mr. DeBlanco, I'll get your mic on for you and you will have the floor, sir.
Thank you. Good evening to the committee. I'm Curtis DeBlanco. I'm the Director of Finance for the city. Tonight, I'll be presenting the year-end financial report for 2023. This report provides the committee with an update on the 2023 budgets and anticipated 2023 surplus for each, as well as the expected closing balance of reserves at year-end. The city's audited statements are set to be presented to council in April upon the conclusion of the field work by the city's auditor. All municipalities must prepare annual financial statements and then make these, as well as the auditor's report, available to the public by May 1st. The figures in the council or the committee report tonight have not been audited and therefore considered preliminary. The values, including any surplus or deficit, may change slightly due to adjustments made as part of the year-end process and any adjustments recommended by the city's auditor. Looking at page 2 of attachment 1, which summarizes the municipal operating budget, this is supported by taxes to fund services such as recreation, protective services, road maintenance, among others. The quarterly report for the third quarter of 23 had forecasted a municipal operating surplus of approximately $285,000. Once again, although preliminary, the municipal operating surplus is approximately $217,000 within this report. The specifics on the factors that contribute to this are detailed within. I'll go through them at a high level, but I'm not going to get into every specific variance. City Council did approve a 4.9% tax increase. This provides $25.4 million in tax revenue. So what we saw is that the city recognized $1 million of overall revenue in excess of the total budgeted revenue amount. This is attributable to several areas. Most notably, we saw licenses, permits, and fines at $200,000 to the good, government transfers at $300,000, sales and user charges $200,000, investment income $300,000. The report, once again, details the specifics on the individual drivers that lead to the variances, but at high level, there was an 18% surplus of sales revenue for things like increased membership and drop-in revenue at the city's rec facilities, such as the BSRC. The city saw an increase of 75% over budget for permit revenue, as well as increases in interest rates throughout the year resulted in additional investment income. I always like to note on investment income that this additional amount is subsequently transferred to reserves in an offsetting transfer. What this does is mitigates the city's interest rate risk for fluctuating interest rates. On the expenses side, municipal operating expenses exceeded the budget of $50.1 million by about $500,000. Once again, there's some large variances at the department level in the report. Overall operating expenses are forecast to come in within that 1% of the improved budget. Some of the larger drivers that contribute towards either a surplus deficit are casual labor staffing that we saw at the BSRC, particularly in aquatics, increases to the city's RCMP contract, as well as an increase in facility costs for repairs and maintenance and janitorial. Next section there is just transfers. So before transfers, the net surplus was set at $500,000. Shown on the report are $1.4 million in draws from the city's operating reserves, as well as contributions of $3.6 million to the city's capital reserves. Draws from these operating reserves are to fund one-time projects. Depending on where these projects are at, that ultimately determines what does get transferred. Reserve funding for these one-time projects that were still underway at that December 31st, January 1st cutoff were carried forward at the January 23rd council meeting. And then overall, the net impact of these in and outs of transfers reduces the surplus by $300,000. So at the time of this report, what we're seeing is that $217,000 overall surplus. This is an equivalent of 0.4% of the overall municipal operating budget. And just like any other year, if there is a surplus, administration will recommend transferring that amount to an appropriate reserve. Typically, it's the financial stabilization reserve. Next on the utility operating budget. So that's the budget that is funded by utility fees. What we're seeing is utility revenue came in at $300,000 below what was budgeted, and what we saw is that based on consumption data, customers are averaging a usage of 204 cubic meters of water per year. What we saw in 2022 was actually 213, and we can tell from the additional usage in that year was just the work from home policies that continued in the start of 2022. We saw the average water consumption go down in 2023. And with that data, we plug that into our 2024 model. So the 2024 utility budget has been forecast based on this more normal data. This reduction in revenue on utilities is offset by directly by the commission fees paid to the water and wastewater commissions. So overall on the utility operating budget, we're seeing a $133,000 surplus. On capital, as of the end of the year, 46% of the approved budget had been spent. But when we take some of these larger projects that had a bit of scope changes out, that number becomes 72%. Projects not completed by year end did have any remaining budgeted funds carry forward into the 24 budget at that January meeting I mentioned. On renewal programs specifically, we saw an overall savings of 13%. And because those programs are funded from reserves, those reserve dollars just stay in the reserves to fund future renewal and replacement in a future year. So excluding the variance on the Beaumont Innovation Park and Joint High School site, the city saw a savings of $1 million on growth projects. And then on the utility capital projects, we're forecasted to see a savings of approximately 5%. Next section here is the city's reserves. Municipal operating and utility operating budgets saw reserve draws of 1.4 and 0.3 million respectively. This is 600,000 less than the approved budget. And then on the capital side, 5.1 million of a budgeted 5.6 was required to fund those capital renewal projects. Just looking at the individual balances of reserves, we have some icons there indicating good, bad, needs work. The financial stabilization reserve is forecast to have a balance below optimal. In this case, the optimal is 5% of the prior year's operating expenses. The last year's deficit transfer was a contributing factor to that of approximately 0.9 million. The transportation renewal reserve is below the 2% tangible asset cost, which is set forth in the reserves policy. The balance is set to increase beyond this level from the allocations in 24. The Economic Development Reserve has a minimum balance of 1 million. Once again, it's anticipated this reserve will be replenished in 2024. Fleet and Equipment and Parks Reserves both have a balance that, if we look across the 10-year horizon and look at what's being contributed, eventually will not meet the amount needed to replace over that long term. So what will likely become a recommendation in a future budget will be an increased allocation to those, as well as potentially after the conclusion of the audit, looking at all of the balances, seeing if any are overfunded, underfunded, and perhaps a shifting between those amounts. Important to mention is that administration is undertaking a very significant review of its reserve planning this year, and may recommend increased allocation to reserves in a future budget or that reallocation that I just mentioned. So following completion of the annual audit, so at April, we will either recommend a surplus in either of the operating budget be transferred to the appropriate reserve, such as financial stabilization or utility. The flip side, should something occur and we end up in a deficit position, then the recommendation is that a draw from those respective reserves be made to cover that deficit balance. With that concludes my report, and I'll turn it back to committee. Thanks.
Mr. Blanco, thank you very much for that report. Very, very detailed information, but generally good news story, which is much appreciated when it comes to finance of the city. I have some comments at the end. I'll go to my councilors first for questions. Councilman Newkirk, you have the floor.
Yeah, thank you, Mr. Blanco, for the thorough narrative. I think the easy thing to do with reports such as this is go and start cherry picking big numbers that are in brackets or not, and ask those questions. And through the narrative written and received right now, you hit on all of those items. The community often doesn't understand those, and for anyone in the community who's wondering about those numbers and want better and more explanation, please reach out to the city around that. Because like I said, it's very easy to just cherry pick big numbers off a chart and misrepresent them. So I'll stop there on that. And another thank you for adjusting the reserve table to have the little small icons on the right. I think that visual is very, very helpful for folks. It's definitely helpful for myself, and from budget to now, the little tweak that you made was great and noticed, and I thank you for that. So those are my comments, Mayor.
Thank you, Councillor. Appreciate that. Any further comments or questions from members of council? Okay, seeing none, I will have a couple of comments myself. Again, great report, good information, a lot to absorb in a short period of time, even though I read it a couple of times myself. Kudos to the city administration to come in less than 1% variance on a $55 million budget. Be on the surplus side is no small task. Not just finance, every department has to do their part to make sure the money we allocate in that department based on our tax base, what we collect for taxes, has to be accounted for. We have to mind our pennies, and to come in that close is a huge task, and it's much appreciated. Many people understand finance, appreciate it, but many of our taxpayers don't. At the end of the day, we're not taking more money than we need to run the city. If you have a surplus of 3 or 4 million, one could argue you've taken too much in taxes, didn't need it. We're not doing that. We are razor thin on our variance, and that means administration did a great job managing the money they've got in each department. Finance did a good job, and council made a good decision on the tax increase last year to put us within variance of less than 1%. So I think kudos to everybody for doing a great job on that. It's a good news story, and I appreciate your report, Mr. DeBlanco. Seeing no further questions, we'll move on to our next item. Thank you, Mr. DeBlanco, for that presentation. And next council on our item is councilor inquiries. Councilor Barnhart's and Councilor Telebus both had information brought back to them. If you have any subsequent questions, you need to make a new inquiry based on what you received for information. So I'm assuming you have no further inquiries on that at this time. You can at a later time if you want to, but as far as tonight goes, you're good with that information you received. Good, I appreciate that.
Am I allowed to ask for some clarity on it, or just on the information provided?
It would only provide a new inquiry. Madam Clerk, can you maybe help me with that? My understanding is any kind of clarification may require a new inquiry. Madam Clerk.
Mr. Mayor, it's fine to ask the question. If we don't have the answer, we'll just treat it as a new inquiry.
Okay. Councilor Telebus, please ask your clarifying question, and we'll hopefully help you tonight, or it may require a new inquiry. You have the floor.
Thank you. I guess, so this initial inquiry stems from a lot of business owners who are quite frustrated and upset with the new development that's in place right beside their businesses because of how it's structured there, the types of businesses, and then adding all these additional requirements for parking. So my question for clarification here is, there's mention here that the development authority may consider approving a variance to relax the standard. Was this done in this scenario for the inquiry here for the Plan 202 1479? Sorry, Block 1, Lot 10A?
Madam Clerk.
Mr. Mayor, unfortunately, that's not a question that we have staff present on hand to answer. However, we will treat it as a new inquiry and we'll make sure that the information is circulated just as per usual.
Okay, thank you.
Thank you, Councillor Natellenbos.
Thank you both. Appreciate that. Seeing no further items under 6.1 or 6.2, our next item is a closed session, council remuneration review presentation. So with that, I'll ask for a member of council to move into closed session. Kat, you remain on the phone, of course. Or Councillor McCook, sorry, you'll remain on the phone. Member of council willing to move into closed session. Councillor Barnhart.
Thank you, Mayor. I move that committee of the whole move into closed session at 7:30 p.m. pursuant to sections 24 and 29 of the Freedom of Information and Protection of Privacy Act.
Thank you, Councillor. Discussion on the motion, members of council. Seeing none, council, please vote on the motion to move in camera. Councillor McCook, how do you vote?
In favor.
Thank you. Council, that carries unanimously 6-0 to move into closed session. Thank you. We are live again after our closed session. We have no business arising from that closed session. So with that, we are adjourned at 8:36 p.m. and we will reconvene with a special council meeting in a few moments here. We can continue live, can we not, at this point and call the special meeting to order?